Sarah. I'll be your nurse taking care of you today. Can you please state your full name and date of birth?
Stated.
All right, I'm going to go ahead and take a look at your wristband, okay?
Okay.
All right, perfect. And can you tell me if you have any allergies?
No.
Any pain?
No.
All right. So what we're going to go ahead and do right now, we're going to do a physical assessment, which takes about 20 to 30 minutes. Do you have to go to the restroom?
No.
All right. At this moment, we would check for the patient's gait, posture, hygiene, grooming, anything of that norm. Everything's within normal limits for this patient. So we're going to go ahead and continue. All right. And then can you tell me who the president is?
Stated.
All right. And can you tell me why you're here?
Stated.
And do you know the reason why you're here as well?
Stated.
And do you know what year it is?
Stated.
All right, perfect. So at this point, we went ahead and obtained the vital signs, which was the blood pressure, temperature, pulse, and respirations. And we're going to go ahead and continue with our assessment because the patient's not showing any signs of diaphoresis, no cyanosis, respirations, or even in labor, no signs of distress, nothing within that range. Okay, so I'm going to put my gloves on and we're going to go ahead and put the patient in semi-Fowler's position. Alright, so next thing we're going to go ahead and do, we're going to go ahead and take a look at the patient's head. And at this moment, we're going to go ahead and just feel for any bumps, lesions, abrasions, anything like that. No signs of pediculosis or anything. And now we're going to go ahead and continue with the eyes. And we're going to go ahead and with this, we're going to check for PRILA, which is pupils round, reacted to light, and accommodation. And with this, I'm going to go ahead and check for dilation and constriction. Alright, now we're going to check for the ocular motor. Alright, just follow my pen light right here and without moving your head. Alright, perfect. Fantastic. Now we're going to check for the visual field. Just let me know when you see my pen light come across, okay? Alright, perfect. Perfect. Alright, the next thing we're going to go ahead and do, we're going to check for your sinuses. Make sure you have any infections from the maxillary right here and in the front. And what we're doing, we're moving upwards, making sure we don't feel any bumps or anything like that, knowing that I have no signs of infection. Alright, so what we're going to do next, we're going to go ahead and take a look at your nose. Make sure you have no deviated septums. Do you have any histories of nosebleeds? Any past surgeries? Did your nose break recently? No? Okay, perfect. Alright, oops, sorry, I'm going to do that. Do that. Alright, good. I'm going to go ahead and check the patency right now. Go ahead, blow for me. Alright. Go ahead, blow. Perfect. Alright, next thing that we're going to go ahead and check for is your mouth. So can you say ah for me? Alright, so we're checking and everything looks good. Oral mucosa is pink and intact. Tongue's not showing any signs of dehydration or anything like that. Are your teeth dentures or real? Okay, your own. Okay, perfect. All right, next thing that we're gonna do, we're gonna go ahead and look at your ears and pulling the peanut up, back and up. We're gonna go ahead and check, make sure you doesn't have any excess of wax or anything like that. And we're gonna go ahead, come around the side and check as well. Pulling back and up. All right, perfect. And now what we're gonna do, we're gonna go ahead and do the Rhines and Weber's test, which check for air and bone conduction and hearing loss, and also we'll check for the whisper test. Can you hear me? All right, can you hear me? Perfect. All right, from this point, we're going to come back around. And what we're going to check for, we're going to palpate the lymph nodes, making sure there's no swelling or anything. Does this hurt or anything? No? Okay. And what we're going to go ahead and do now is just check for tracheal placement, make sure that's not displaced or anything like that. And we're going to go ahead and check for the carotid pulse. Okay, good. All right, perfect. All right, next thing that we're going to go ahead and do, we're going to go ahead and listen to your lung sounds. Before we do that, since we're right here, go ahead and turn your, from your ear to your right shoulder, just press it like, go downwards like that. All right, and then we're going to do like that. We're going to move to our left shoulder, and then we're going to lift, push your head back, and then can you put your knee to your chest? All right, perfect. All right, no problems with that. Now we're gonna go ahead and auscultate. Make sure it's warm. All right, we're gonna go ahead and listen. All right, and we're gonna actually pull this down a little bit, okay? All right, and there's chest isn't barrel or anything like that. No signs of barrel chestness or anything. It's normal. And we're gonna go ahead and now listen. All right, listening to the 4 quadrants. Sound clear. And we're gonna go ahead for the right side. We're gonna listen to the 3 sides right here. Perfect. And then 2 sides on the side. Okay, sounds good. Now, since we're here, we're gonna go ahead and listen to the aortic, and that's basically on the 2nd intercostal space on the right side. Okay, and then we're going to go ahead and listen to the pulmonary. Okay, now we're going to go ahead and listen to the herbs, coming down a little bit, okay? And that's at the 3rd intercostal space, and then we're going to go ahead and listen to the tricuspid, which is right here on the 5th, and then the mitral is going to go ahead and be in the mid-5th intercostal space right here. Okay, everything sounds pretty good. I'm going to go ahead, this aside, and now I'm going to go ahead and percuss. And then we're going to palpate going 2 centimeters in, no more than that. Okay. All right, so since I have you up here, I'm going to have you sit up for me, okay? Now listen to the back of your lung sounds, okay? Oh, that's it, okay. All right, so now what we're gonna do, we're gonna have you lift up. The bed moved. That's fantastic.
You got it? Okay.
Yeah. We're gonna go ahead and listen to your lung sounds on the 6 spots on the back. So we're gonna go ahead and take a deep breath. We're gonna take a deep breath. Take a deep breath. All right. Okay, sounds good. All right. Now we're gonna do the chest excursion, which we basically make as a V and we'll put on the back. All right, and the next thing we're gonna do, we're gonna go ahead and percuss and palpate, make sure nothing's like that. At this time, we were already had and inspected the patient's back. There's no lesions, no abrasions, no scars or anything like that. So we're gonna go ahead and have them lay back down. All right, and now I'm gonna put the patient back in a supine position. All right, what we're going to go ahead and do now, we're going to go ahead and actually check for the reflexes on their tricep, bicep, and then brachial radialis. And then we're going to go ahead and check for the brachial pulse at the same time. All right, we're going to go ahead and put this arm out, okay? And we're going to go ahead and check for the radial pulse, same time. And then we're going to check for the Allen's test, where they're going to ball their hand up in a fist. And we're just going to check for capillary refill. All right, letting go of ulna first. All right, perfect. Do the same thing over here. Go to ulna first. All right, perfect. And what I'm going to go ahead and do, can you go ahead and squeeze my fingers? Real tight. Okay, perfect. And we're going to check for capillary refill as well. We're going to go ahead and do some range of motion simultaneously. Perfect. And then lastly, check for the reflexes on this arm as well. All right. Any pain or anything like that? No? Okay, perfect. We're going to just keep on going. Now we're going to go ahead and go to the abdomen. inspecting the abdomen. All right. Intact, no scars or anything like that. Can you tell me when your last bowel movement was? Are you taking any laxatives, anything that makes you constipated, anything? No? Okay, perfect. And then when was the last time you voided? All right, perfect. All right, do you strain when you're having any bowel movements? Any odor with the urine or anything like that? No? Okay, perfect. So now we're going to go ahead and we're going to go ahead and auscultate. For bowel sounds, what we're going to start is at the lower right quadrant. All right, perfect. I'm going to work our way in a clockwise motion. What we do, we listen for 1 to 5 minutes, or 1 minute is your period time. And if you don't hear anything, you listen to 5. If after 5, we'll rule out bowel sounds are absent. All right, go ahead and listen. All right, and since I'm auscultating right now, what we're going to go ahead and do is listen to a breathe. We're going to go ahead and listen to the aorta in the epigastric region. All right. And then we're going to go ahead and listen to the renal. Okay. Then we're going to go ahead and listen to the iliac. And then what we're going to go ahead, we're going to listen to the femoral right here between the joints. Okay. Femoral will be really right in there. Okay. All right. If there were any sounds or anything like that, a rushing sound that'd be abnormal. Since there are no sounds, that means nothing abnormal is happening. We're going to go ahead and put this cover back. Since we're good there, I'm going to go ahead and pull your covers up from the lower section, okay? One thing I forgot, I'm sorry, go ahead, we're going to go ahead and do your percuss, and we got to go ahead and palpitate. Alright, so we're going to percuss. We're going to go ahead and palpitate. Any pain? What we're checking for is any dissensions, any nodules, anything like that. Alright. Now we're going to go ahead and check the lower extremities, okay? Alright. Alright, inspecting the skin, we see that they have a wound here. Alright, so what happened there? Okay, it was just wrapped, it just had a little skin tear there. Okay. Alright, and it was just wrapped about 20 minutes ago. Perfect. Alright, so what we're going to check for is a saphenous vein right here. Alright, make sure that's okay. Going down, okay, perfect. What we're going to go ahead and do is check for the reflexes, the patella, the Achilles, and the plantar Babinski. Okay, we're going to do the same thing here. Patella, Achilles, and plantar. Okay, perfect. All right, we're going to go ahead and check for your pulses now. Bend a little bit. Okay, perfect. Okay, and hear it. And this is the popliteal. Then I'm going to listen to the posterior tibialis, that's here, and then dorsal pedis, that's here, and doing it at the same time. Posterior tibialis, and then dorsal pedis. Alright, then what we're going to go ahead and do is just check for the femoral artery as well, which is right here. Alright, perfect. Alright, next thing we're going to go ahead and do is do some range of motion simultaneously. Alright, perfect. No pain? Alright, perfect. Alright, I want you to go ahead, resist my hands. Alright, perfect. And now push against my hands. Perfect. All right, one of the last things I'm going to ask you to do is actually turn to your side because we're just going to inspect your back and also your buttocks. And before we do that, we will go ahead and check for the genitalia. With the genitalia for the women's, you would go ahead and lift up both their arms like this, and then go ahead, go to the back, and then you will go from the nipple to outwards and go in 4 regions, and then making sure there's no nodules or anything like that. Then also you will have them put their hands on their hips and then have them bend over, and then just making sure that the nipple does pop out, letting us know there's no signs of tumors or anything like that. Okay. So, and then for the males, we'll check for their scrotum, pull the shaft back, make sure there's no lesions or anything like that. And also checking the scrotum, make sure the balls, scrotum sacs are even. And making sure there's nothing there. And also for women's, for their genitalia, we'll go ahead and pull back the labia, just make sure there's no lesions, no warts, nothing like that, no discharge or anything of that order. So now we're going to go ahead and turn you to your back side. Okay. All right. 1, 2, 3. Alright, just inspecting the back and wearing different gloves now. No lesions, no nothing like that. And then what we do for the buttocks, making sure there's no, external hemorrhoids or anything like that, anything out of the norm. What we're going to do now, we're going to go ahead and check your anus. What I need you to do is take a deep breath in and deep breath out. And then once the splinter is relaxed, you go ahead and insert one finger in, just making sure, checking for internal hemorrhoids, anything of that nature. Alright, perfect, skin's intact. Come back around. Alright, so that's our head to toe assessment. Feeling okay? Okay. Alright. Alright, and then at this point in time, patients saying that there are no complaints of pain or anything like that. They're doing perfectly fine. And we're going to go ahead and just document our findings. And then sanitize out. I'm going to wash my hands. Beds in lowest position, call lights within reach. Call lights in reach, and beds locked and lowered.